Alright, so the date is March 12th, 2020 at 0810 hours. I'm going to begin by comparing my physician's order with my MAR to make sure I have the correct patient. So nursing Jake, Finn 312, 654, 987, 987. So I have the right patient. This patient, nursing Jake, he has no known allergies. So now I'm going to begin by making sure that all my medications are double signed by a transcriber and a nurse. I'm doing so, and they are, so that means I'm legally allowed to administer these medications. Alright, so now I can go ahead and start comparing my physician's order to my MAR to make sure I have the correct medications. So ibuprofen, correct medication. 120 milligrams, 120 milligrams, correct dose. Per oral, correct route. BID, correct frequency. And it's scheduled for 0800 hours. The time is now 0810 hours, so correct time. Next, I have ciprofloxacin 0.3%, ciprofloxacin 0.3%, correct medication. 2 drops, correct dose. To the right eye, correct route. TID, correct frequency. And I see here that it is scheduled for 1400 hours, and since it's 0810 hours, I won't be administering this medication. Next, I have Gravel, correct medication, 50 milligrams, correct dose. Per oral, correct route. BID, correct frequency. And it's scheduled for 0800 hours. It is now 0810 hours, so I'm okay to give this medication. It's the right time. Lastly, spironolactone, correct medication, 50 milligrams, correct dose. Per oral, correct route. Daily, correct frequency. And it's scheduled for 0800 hours. And since it's 0810 hours, it's the right time. So now that I've confirmed my medications, I don't need my physician's order anymore. So now I can go ahead and start pulling my medications out from the med bin. So I'm grabbing ibuprofen. I'm checking to see if it's expired. It isn't expired. Next, I'm pulling out Gravel. This is Gravel. I'm checking to see if it's expired, and it isn't expired. Lastly, I'm pulling out spironolactone. This is spironolactone. I'm checking to see if it's expired. It's not expired. So since all my medications aren't expired, I'm free to safely give these medications. Alright, so now that I have all my medications, I can go ahead and start preparing them. I'm going to start by preparing ibuprofen. I need 120 milligrams. The concentration in the bottle here is 100 milligrams per 5 ml. So I'm going to draw up 6 ml, so I get 120 milligrams. So I'm going to perform hand hygiene. Grab a cup, syringe. I'm going to shake it up. Keep that out. Putting the lid on its side. One bubble. Perfect. Alright, so I have 6 ml. I'm not going to use that anymore. I'm going to use a cup just to protect the tip here. I'm going to dispose of my excess ibuprofen, and I'm going to go ahead and create my med label right away. So this is for nursing Jake. Drug name is ibuprofen. The dose is 120 milligrams. Volume is 6 ml. Concentration is 120 milligrams per 6 ml. The date is March 12th, 2020 at 0800 10 hours, and I am TP UMSN2. I'm on low power. Okay. Next, I'm going to prepare gravel. So I'm pulling out my gravel. I need 50 milligrams. The concentration in the bottle here is 50 milligrams per tablet. So I'm going to pull out 1 tablet. I'm going to perform hand hygiene. Perfect, 1 tablet. And I'm going to prepare the med label right away. So this is for nursing Jake. Drug name is Gravol. Dose 50 milligrams. Volume 1 tablet. Concentration 50 milligrams per 1 tablet. Date and time is March 12th, 2020 at 0800 10 hours, and I am TP UMSN2. Quick little shot. So gravel is prepared, and lastly spironolactone. I need 50 milligrams. The concentration in the bottle is 25 milligrams per tablet, so I'm going to pull up 2 tablets. I'm going to perform hand hygiene. And I'm going to go ahead and prepare that med label right away. So this is for nursing Jake. This is spironolactone. Dose 50 milligrams. Volume 2 tablets. Concentration 50 milligrams per 2 tablets. Date is March 12th, 2020 at 0800 10 hours. Signatures TP UMSN2. Perfect. Alright, so now that I have all my medications prepared, I'm going to go ahead and do my second check. So I'm going to begin with ibuprofen. And pull ibuprofen out here. So I need ibuprofen. This is ibuprofen, and I have ibuprofen here, so that's the correct medication. I need 120 milligrams. The concentration in the bottle is 100 milligrams per 5 ml, so I need 6 ml. And I have 6 ml here, so I have 120 milligrams. The concentration is 120 milligrams per 6 ml. So there I have 6 ml. It's all the way to the top. No bubbles. So correct dose. Next, it should be given per orally. This is oral suspension. I have an oral syringe, so I'll be able to give it orally. So correct route. It should be administered BID twice a day. the time is 0800, or it's scheduled for 0800 hours. I have the time here 0810 hours, so it's the right time and frequency. So this is for nursing Jake, and I have nursing Jake here on my med label, so this is for nursing Jake, so correct patient. So ibuprofen is double checked, so I can go ahead and put ibuprofen back in the med bin. Next I'm going to pull out Gravol. So I need this for nursing Jake. I have nursing Jake written here, so I have the correct patient. I need Gravol. This is Gravol, and I have Gravol, so correct medication. I need 50 milligrams. The concentration in the bottle or the container is 50 milligrams per tablet. I have one tablet here. One tablet. So correct dose. It should be administered per orally. These are tablets. I have a tablet, so I'll be able to administer it orally at the bedside. It should be administered BID twice a day. It's scheduled for 0800 hours. I have here, it's 0810 hours right now. So correct time and frequency. So Gravol is double checked. So I can go ahead and put Gravol back in the med bin. Lastly, I have spironolactone. I need this for nursing Jake. I have nursing Jake written here on my med label, so correct patient. I need spironolactone. This is spironolactone, and I have spironolactone, so correct medication. I need 50 milligrams. The concentration in the bottle here is 25 milligrams per tablet, so I need 2 tablets, and I have 2 tablets here. 2 tablets. So correct dose. It should be administered per orally. These are tablets, and I have tablets, so correct route. I'll be able to administer it orally, so correct route. It should be given daily. It's scheduled once for 0800 hours. I've written here 0810 hours. That's the current time, so right time and frequency. So spironolactone is double checked. And I can go ahead and put this back in the med bin. So it's put away. So now I'm able to collect what I need, a cup of water for the bedside, and I have my MAR and all my medications, so I can go to the bedside. So I walk to the bedside, or I don't walk to the bedside, I walk to the room, I knock on the door, walk inside, perform hand hygiene, say, "Hi, my name is Tom Prazak, I'm a student nurse at the U of M. I will be administering your medications today." And as I walk in, I assess the room. I see if there's any hazards, any cords or wires or any hazards around his bedside. He's at the lowest setting. He has call lights, so I do my safety check. Everything is fine. So then I proceed to the bedside, say, "Hello, Mr. Nursing. How are you doing?" I'm going to compare my MAR to his ID band to make sure I have the correct patient. So nursing Jake, date of birth January 1st, 1960, date of birth January 1st, 1960. So this is the correct patient, but I'm going to get nursing Jake to verbalize his name and birth date, and he does. So we have the correct patient, and I see here that he has no known allergies, so I'm going to ask Jake if he has any allergies, and I ask him, "Do you have any allergies?" He says he doesn't, so perfect, we can go and proceed. So I'm going to do my third check. So first I'm going to check ibuprofen. So I need this for nursing Jake. I have nursing Jake here written on my med label. I just confirmed that this is nursing Jake, so I have the right patient. I need ibuprofen. I have ibuprofen here, so I have the correct medication. I need 120 milligrams. My concentration here is 120 milligrams per 6 ml, and I have 6 ml. No bubbles, and it's full to the top, so correct dose. Next, it needs to be administered orally. I have an oral suspension here. I will be able to administer it orally right away, so correct route. Next, BID, it should be given twice a day. It's scheduled for 0800 hours. The time is now 0810 hours, so I have the right time and frequency, so ibuprofen is a go. triple checked. Secondly, I have gravel. I need this for nursing Jake. I have nursing Jake here written on my med label. And I just confirmed that this is nursing Jake, so I have the correct patient. I need gravel. This is gravel. I have gravel here, so correct medication. I need 50 milligrams. The concentration here is 50 milligrams per tablet. There is one tablet, so I have the correct dose. I should be administering this orally. This is the tablet. I'll be able to administer it orally right away, so correct route. BID. It should be administered BID twice a day. It's scheduled for 0800 hours. I have written here 0810 hours. That's the current time. So right time and frequency. So gravel is triple checked. Lastly, spironolactone. I need this for nursing Jake. I have nursing Jake here written on my label. This is nursing Jake. I just confirmed that. So correct patient. I need spironolactone. I have spironolactone. So correct medication. I need 50 milligrams. I have 50 milligrams in 2 tablets. That is a concentration. Confirming I have 2 tablets. So correct dose. It should be administered orally. These are tablets here, so I'll be able to administer them orally right away. It should be administered daily. It is scheduled once at 0800 hours. The time is now 0810 hours. I have it written here. So right time and frequency. So spironolactone is triple checked. Alright, so now I can go ahead and start administering my medications to Jake. I'm going to raise his bed and I'm going to sit him up. So he's sitting up. So hi Jake, I have your medications here. I'm just going to teach you a little bit about the medications that we have here. So our first medication is ibuprofen. Ibuprofen is an analgesic. We're using it to treat your pain that you've been experiencing. Some side effects you might experience are drowsiness and headache. Beforehand, I've checked your renal status to make sure it's functioning properly, so you can properly eliminate this medication after it's reached its therapeutic effect. So everything's good to know, good to go. Something you should know about ibuprofen is you should be taking it on an empty stomach, and you're on an empty stomach right now, so that's perfect. And yeah, so next I have gravel. Gravel is a antihistamine. We're using it to treat your nausea. Some side effects are dizziness and hypotension. Beforehand, I've monitored your vital signs, specifically your blood pressure, and everything is in a normal range. So we're good to continue with administering gravel. Something you should know about gravel is that you shouldn't be drinking any alcohol while you're taking gravel. So stay off the booze, stay off the alcohol while you're on gravel. And yeah. So lastly here, I have spironolactone. Spironolactone is a potassium-sparing diuretic. So what we're using it for is to hopefully subside your edema. So reduce your swelling that you have. Some side effects you might experience are diarrhea and itchiness. Beforehand, we've monitored your vital signs as well, specifically your blood pressure, and everything is good to go. Something you should know is you might experience some increased drowsiness, and you might feel lethargic, and your urine output should increase. So, perfect. Alright, so I'm performing hand hygiene. Here, Mr. Jake, nursing. Is it okay if I administer ibuprofen? He says yes. I give him the ibuprofen. Here's some water. Check to see he's swallowed. He's swallowed. Perfect. So next, is it okay if I give you your gravel? He says yes. So I give him his gravel. Takes his gravel. Give him some water right away. Check to see that he's swallowed. He's swallowed. Perfect. And lastly, is it okay that I administer your spironolactone? He says yes. So here's the spironolactone. Some water again. Perfect. Check to see he swallowed, and he swallowed. So now that I've administered all the medications, I'm going to go and sign my MAR. So I'm writing the time I administered these medications, my initials, and my designation. Look, so there's the ibuprofen. Alright, so I signed, documented the MAR, so just to confirm that I've administered these medications. I'm lowering Jake's bed. I'm keeping him sitting up for now. So Jake, I'll be back in half an hour. I'm going to come back and I'm going to monitor your pain levels. To see if they subsided. I'm going to come back and check your vital signs, specifically your blood pressure, to see that everything's normal. In regards to taking the gravel and the spironolactone, I'm going to check to see if your nausea has subsided and to see if your swelling has gone down. So here's a call light. Here's a call light. Everything's good. I'm doing a safety check as I leave. He's at the lowest setting. He's still seated up. He's comfortable. And now I can go ahead and leave the room with my medication.